Hi everyone, welcome back to Health First. Today I am here with Dr. Jowhar, who is an internal medicine resident physician. Hi Dr. Jowhar, how are you?
Good, I'm good. Glad to be here.
Thank you so much for joining me. I would like to start off by asking what influenced you to go into the medical field?
That's a good question. What influenced me was knowing that medicine can help me, advance science and also work with people directly. I was in a graduate school program working on my PhD, and then I really miss working with people.
Mhm.
So, after doing some research, I figured out, hey, medicine can let me do both, which are things I'm passionate about. So that's what led me into medicine.
And you work in internal medicine. Why did you choose this specialty?
The reason I chose internal medicine is because, it's very hands-on job. So, you're, dealing with, your patients from, all walks of life. You get to work in different settings, in the emergency room, in the clinic, in the ICU. So, it's just a nice broad field where, you can get to, work with people, help people, and use your knowledge. So, it fit with my personality.
Mhm. Can you tell me a little more about your specialty?
Sure. Right now, I'm an internal medicine resident. So, internal medicine doctors are the doctors you typically see when you're admitted into a hospital. So, if somebody's sick, the team that most of the time takes care of them is an internist. So they deal with the diseases of all the organs. So somebody with like diabetes, high blood pressure, HIV, cancers. All these doctors, for the most part, they train in internal medicine and then they specialize. So your heart doctor, cardiologist, is an internal medicine doctor first. Then they get special training in the heart. Specialties like you're like a cancer doctor, for example, they train in internal medicine first, and then they specialize in cancer. So
Mhm.
they get additional training. So that's, it's a nice broad field.
Mhm. Definitely. As you know, the COVID-19 pandemic has greatly affected the nation and continues to do so. How is it like working during the pandemic and how are you able to help people?
For sure, COVID has touched everyone's lives. Even if they don't have the disease, somebody they know has been affected. In our case, I actually, currently I'm working in the intensive care unit where we have a lot of COVID patients. So, it's kind of a mix. On the one hand, COVID is a new disease, so it's kind of scary, right? Because we're just learning about it. So, making sure that we take care of our patients, but also at the same time, it's scary. Like, there's a lot of people that have been hospitalized, and a lot of people have died. So, I think like keeping in mind, using like the latest research to protect ourselves and also our patients, and then just pushing through. It's very tough on everybody, from the doctors to the patients' families, even people who are watching it on the news.
Mhm.
But it's one of those times, that's why medicine is big on service. You're doing things to help others, even when it's tough. So we just push through, and I just got my vaccine, my COVID vaccine. So hopefully it works.
Yeah. Do you believe the COVID vaccine will make a big impact and are you for it?
I'm definitely for the vaccine. I believe it can make a big impact, but it depends on who all the whole is participates.
Mhm.
So even though we're getting the vaccine, we're encouraged to still social distance, put our masks on, and it's they've done a lot of research to make sure that it's safe for patients, but
Mhm.
there's a lot of stuff we don't know about the disease. So I
Yeah.
think if everybody still follows the the basic precautions like washing hands, um, putting on their masks,
Mhm.
and then just self isolating if they're sick. I think it'll make a big impact, but it takes a lot of people to be involved to make it successful.
For sure. Can you give a few words of advice to the people of my generation hoping to go into the medical field?
Sure. So you guys are the future. I would say the number one thing is to figure out first what makes you happy and what you really want to do.
Mhm.
So, don't get me wrong, being a doctor is a very nice, it's a very nice job. It has lots of opportunities, but the people I think who make the best doctors are the ones that are very passionate about it.
Mhm.
So, if that's something, that your generation is passionate about, and that they really love doing it, then, what I'd say is, like, talk to the doctors around you. Like, you can watch your channel. I know I've seen you interview other doctors, um, talk to family members, friends of family members, so they can learn about it. And then once they get once they get a better idea, then, they can pursue it. But you have to really know what you want first, and the rest of it is easy.
Mhm. Thank you so much for joining, Dr. Johar, and
Yeah,
thank
no
you
problem.
for your time today.
Oh, my pleasure.